AM 950, the progressive voice of Minnesota. Brett Johnson filling in for Matt McNeil here on this Tuesday afternoon. Well, today, Aaron Brown of Minnesota Brown is going to share a story that sheds light on the realities of healthcare disparities in rural Minnesota and even largely to rural America. Because back in November of 2022, Aaron's mother suffered a life-threatening stroke. She faced numerous challenges due to delayed diagnosis and inadequate facilities in their rural Hibbing hospital, and her story really underscores the urgent need for changes in rural health care. Because while Minnesota does have world-class health care, it can sometimes be a different story if you live outside the metro area. Aaron's going to shed light on his mother's journey, the healthcare obstacles they faced, and the need for reforms to ensure that all Minnesotans have access to quality health care regardless of where they live. So, Aaron, thanks so much for joining me on the show today.
Thanks, Brett. Thanks for having me.
Absolutely. So let's back up and talk about what happened in November of 2022. Tell us how this all started with your mom back then and some of the challenges she's faced.
Sure. Well, it was a Friday night, and we went out to a pizza dinner with my wife and some of my sons, and I and my grandmother and my mother went out for a pizza dinner, and it was lovely. And my mother is a child care provider. She worked that day, and went to bed that night after we had all been together, and she woke up very early in the morning. I found this out later, with these flashing bright kind of starburst with huge headaches, and thought that she had maybe just gotten sick because she got sick, and I thought maybe she had caught a bug or something. Well, she woke up like some 8 hours later and couldn't talk or move very well, and so she was able to get to a phone and call my house, and fortunately my son answered, and we happened to be in town, so I was able to run over to, she lives in Hibbing, and we got her into the ER and went through the process. Now, as I explained in the piece, one of the challenges here in rural Minnesota is really it's fundamentally a staffing issue. The people you need aren't just guaranteed to be there. Now, that's partly always true in a rural place, but Hibbing's kind of a rural center. It's not like a little clinic out in the middle of nowhere. They've got a hospital there. And what happened is they did a brain scan, but they only scanned the front of her head because that was the protocol. And she had what they call a basilar stroke, which is more in the back of the head, and it relates more to physical functions like breathing and swallowing and muscle movements. It's had less of an effect on intellection, and so she couldn't swallow and was having difficulty breathing. So she was diagnosed initially with pneumonia. Now, she had all the stroke signs that you see on the little posters they put up about stroke, and so we were concerned, but they had run a brain scan and kind of missed it because of this little technicality of where they scanned. They kind of missed it, and I want to be clear that I'm not, the people, everyone was doing their best, under the circumstances, but it was not getting better, and by the later in the day, another doctor came in and shared our concerns and the concerns of a lot of the nurses, and did a full scan and found the stroke. At that point, there's really no more you can do. The stroke had passed, so whatever damage she had encountered was already incurred. And so, but they did fly her to the cities. It was particularly with her breathing and swallowing, it was kind of dicey. And what that began a 4-month hospital process of getting her out of a medical coma, getting her early kinds of treatments to start working on rebuilding her ability to speak, to swallow, to walk, to grasp, to do all the things that you or I take for granted in walking around and doing things. And, of course, anyone who's been through stroke care or had a family member knows this routine. Basically, though, we were told by many down in the cities that, she's lucky to be alive. Most people who have this kind of stroke under these circumstances don't survive. And so it was life-changing. She was 62 at the time, a working person, not really thinking about retirement, not really worried about her health, and all of a sudden her health and well-being is now her central struggle. And so it's been life-changing, and we've been kind of going through trying, one of the other challenges that we encountered was trying to find her rehabilitation. That was another challenge of living in a rural place. Of course, she was down in the cities at the hospital, and she had to kind of step down to rehabilitative care centers. And one of the challenges that you hear about that's true is there's no beds. We've had a rash of nursing home closures over the past 10 to 15 years in Minnesota. Most of those closures occurring in rural areas. There's a variety of reasons for the closures, and I'll get to some of that when we talk about solutions. But basically, it's just really hard to find a place near home. And the reason that's important is if your whole family lives, for instance, in the Hibbing-Duluth area, in our case, you want to be close by so you can visit. And it's important to her, my mom, important to the family. And, she spent about the first 4 months down in the cities, which, you have to drive, you have to find somewhere to stay, you have to feed yourself, feed your kids, get yourself off of work, and different things you have to do to visit. And so, getting her to a place where she could be cared for and to actually get the occupational therapy and physical therapy and speech therapy that she needed was really difficult. It wasn't until really last June she was able to move, so just over a year ago, she was able to move into a senior housing apartment after a great amount of rehabilitation. And she's regained, I'm happy to report, she's regained a lot of her independence in terms of getting around an apartment, cooking, doing all the different things you do to take care of yourself, but has lost, she lost a certain amount of physical ability and speech ability, and in her case, it's affected her, processing time so she can't drive right now, and so it's a life-changing thing, and we have the United States has the best healthcare system in the world, and the worst healthcare system in the world. The best part is that we have the technologies and we have the trainings and people who can do these great, amazing therapies. The worst part about it is it's really difficult to get that healthcare distributed to the people who need it, particularly across a broad area, and especially when you get into rural areas. And that kind of segues into maybe some of what we need to do.
Absolutely. We are speaking with Aaron Brown of Minnesota Brown, talking about a column he recently wrote in the Minnesota Reformer titled Healthcare Implosions Threatens Greater Minnesota. And as you mentioned, your mom is doing better today, and I think a big reason is that she was able to persevere is that, she had good determination and also a good support system, including yourself. But I guess where I want to go with this is that no one plans on having a stroke or having a family member with a stroke. Mm-hmm. But if you happen to live, let's say, in a metropolitan area, usually it's not terribly difficult to find the facilities you need to get the rehabilitation you need. That might not be the best way to put it. Easy, but it's easier. Yeah, it's easier than if you live in a rural area. And I think there's a challenge that it's easy to forget about if you don't have access to those types of facilities, where all of a sudden you're thinking, that's about a 3 or 4 hour drive to get to those facilities that we need to get to. And yeah, that provides a lot of challenge if you have someone that suffers a major health emergency in a rural area and your facilities just don't have the staffing or the technology to do that. Because as you mentioned, the folks at the Hibbing Hospital did the best they could. It was just really a staffing issue and the lack of resources that they needed to be able to get your mom the care that she needed.
Right, and just for an example, when my mother did come back north, her most urgent need, and of course you have 1 year after a stroke, the earlier you intervene, the better it is for recovery. And so the first 3 months is really important, and after that, every month is still important. But the earlier, the better. And frankly, early is probably when she had the least intervention, just because of the dicey situation she was in. And so when she was in the mid-level care after 2 or 3 months at the university hospital, she was in this mid-level care where we were trying to find her a bed close to where she could get therapies. Well, we couldn't find that bed, and then when we did, we took a while to get the therapies going, to the point that when she did come back to Hibbing, there was a clinic literally across the street. There is one right across the street from her apartment, but they didn't have a speech therapist, and it was difficult to get an occupational therapist at first, and that's just a staffing issue. They literally had vacancies. And that maybe highlights one of the big problems, particularly as you talk about this issue in Minnesota. You'll hear broad agreement across the partisan spectrum, across the healthcare industry itself, that one of the biggest challenges we have is getting people to work in rural places in healthcare. There's not enough people going into it, period, for the whole market. And then incentivizing people to move out to maybe a very rural place where there aren't as many amenities, maybe particularly if the people aren't from there. It's a challenge to get people to move out to rural Minnesota and work in these jobs for money that is, maybe not as great. And so staffing is one of those key issues, and it's both on the supply side, getting enough people to do it, but then also on the demand side, getting the pay and the benefits that would attract more people into nursing, therapist jobs, physical therapy. Some of these jobs require a lot of school. Physical therapists, I think, take 5 years, which is, more than a bachelor's degree, not as much as being a doctor or a nurse practitioner, but up there in terms of schooling. Well, school is expensive, and this is one of the broader issues we've got. And so, getting people into the right places was a challenge. Getting my mom to a local place where she wouldn't have to spend as much time waiting for rides, getting rides. And I also would highlight, we live in a for-profit system, and so if you're in a for-profit system, you have to be thinking about cost, right? That's how businesses work. And one of the challenges is people like my mom are deeply unprofitable. Like, she's $1 million woman, and not just figuratively, as I would normally describe her, but literally, in the sense of her health care probably cost $1 million by the end of it. And so that's not profitable. There's no profitable reason to do that, and particularly in rural Minnesota, where putting people on staff at hospitals and clinics costs money, and if you're not getting the patient load, because maybe only 5 or 6 or 10 or 12 or 14 people need this service at this time, well, they've made the financial conclusion that it's better not to have a full person there. Go ahead and make the people go farther. Some of that is okay. Some of that is just the way it is when you live in rural Minnesota. That's actually one of the arguments you hear. Why do you live there? And to that, I would just point out, my mother was a child care provider making, low 20,000s a year, because she loved providing care to children, and because in the broader sense, every family that brought their kid to that child care center needed my mom and her coworkers to do that job so they could do theirs. And that includes the doctors at the hospital, includes lawyers and miners and police officers and firefighters and all these other people that communities need to do business. And so, this is the thing, is if you want to have a society, you have to kind of care for it at every level. And of course, certain things I would always expect to have to take my mom to Duluth for specialist type stuff. But, physical therapy, speech therapy, these are high-demand services that are really difficult to provide in rural Minnesota right now because of the systemic problems, not because of the people, but because of the systemic problems.
Well, let's tackle some of the issues on how we can possibly improve healthcare in rural Minnesota. And let's start off with the first, and I think most obvious one, is how do we get more people to work in rural hospitals? Because it's tough to get people to move there sometimes, whether it's the pay or if they grew up in an area that wasn't around, it can be tough to get them to stick around. So what are your thoughts on what we can do to get people to work in these areas?
Yeah, well, I say there's local, state, and federal solutions. And what you're talking about is actually one that's really important, I think, for both the local and state levels. Locally, I think a lot of small towns. I'm from a rural area, and I'm from the range, lifelong ranger. One of the challenges we've got is we have a culture of kind of, we want it to be like we remember it, and like we want it, we love where we live, and we don't want it to change too much. And one of the challenges is welcoming new people, especially people with skills that you need, means bringing in people who are different, for very different kinds of different. Could be how they look, it could be how they, where they're from, it could be what they like to do for fun and for a living, and all of these things together. And you have to figure out a way for local towns, small towns, rural places, have to find a way for their own sake to get people to welcome people in. And it's a hard thing to do, and change is difficult. But this is a classic example of where sometimes rural places can be their own worst enemy by saying, "Oh, we want only local people in these jobs." There's not enough local people anymore. There's not enough kids coming up the system through the schools, through the local community and technical colleges. I work at a community and technical college, and that's the problem. The schools don't produce enough graduates, and we don't have enough students going into the careers. And so you've got to encourage not just people to stay and to get trained in these professions. That's one part of it, but also to welcome new people, new professionals into your community. It's good for everybody. And so that's a local thing, though, and it's almost as much cultural as it is political. On the state side, I think you can do a lot more to incentivize people. There's a lot of this with loan forgiveness programs for doctors. What if you did the same for nurses? What if you did the same for therapists? Do more to encourage people to spend longer periods of time working in underserved area hospitals and clinics. There's some of that going on, but I think you could do a lot more of it to help. And then, beyond that, you're talking about some of the bigger systemic issues like Medicare reimbursements and Minnesota care reimbursements, and making sure that the cost of care is covered so that local hospitals and clinics can actually afford to provide that care. And that's one of the disconnects, is the lag between the care being provided and then the people who provide the care getting paid for that care. You can look at broadly systemic change, single-payer systems like other countries have, and you can see maybe more efficiencies in how some of that is done. And of course, politically, I'd be very interested in that. But in the status quo and the climate we're in, you do have to think about practically. We might be a few years from that ever happening. We have to figure out how to make the system work better for the people in it now, which is all of us, really. I mean, any one of us could think everything is going fine, but I'll tell you right now, if you have a stroke tonight, any one of us, all your planning and preparations that you might have made will be tested. And, just because you saved some money and you got good insurance doesn't necessarily mean this will be easy. It will be hard and financially devastating probably regardless. And so what are we doing to help our brothers and sisters and neighbors who go through this? It is literally something that could happen to anyone. And that's the scary part, but also the part that should unite us in doing something about it.
Absolutely, and I think you hit the nail on the head, too, that we have to do something about the Medicare and Medicaid reimbursement rates, especially with rural hospitals, to make sure that they can get the care that they need to their patients. Well, Aaron, we are just about out of time, but I really do appreciate you coming on the show again. Make sure you check out his column in the Minnesota Reformer. It is from a few weeks ago, but you can find it if you just search Aaron Brown and Minnesota Reformer. Title of the column is Healthcare Implosion Threatens Greater Minnesota. Again, find that at minnesotareformer.com. And also find more about what Aaron Brown writes over at Minnesota Brown. That website is minnesotabrown.com. Definitely glad to hear that your mom is doing better since, strokes can be rough. But, she definitely had a good support system to help her get through everything. But, Aaron, thanks so much for coming on the show and having this great conversation with us.
Thank you, Brett. Thanks for having me, and good luck to everybody out there going through this.
All right, we'll take a break and then wrap up the show coming up next here on AM 950, the progressive voice of Minnesota.
When you gonna stop playing?